So I'm a practicing radiation oncologist, and I came to Mayo in Arizona in 1989, actually, after having trained at Mayo Clinic in Rochester. I was really drawn to Mayo because of our value of putting the patients first. Mayo is a very unique organization in that we really try to provide patient-centered care. That is our primary focus. It's bolstered by excellent research, excellent education, but we are really focused on the patient. The other thing that I loved was the team-based approach. So what makes us great as an organization is that we have many different specialists, researchers, educators all coming together with the focus on providing the best care to the patient. And that might seem like a simple thing, but it really isn't in today's healthcare environment. It means that we have adequate time to actually take care of our patients, to see them. We're not rushed to see them. We can get to know our patients. We can provide excellent care. And because we are team-based, we can bring in our colleagues who have expertise areas that we may not, to bring their expertise to the care of the patient. In addition, Mayo is unique in that we're all salaried. So there is no incentive to keep a patient for yourself to provide what therapy you might be able to give the patient because it's going to line your pocket. It allows us to really function as a team without that competition for patients. So for those reasons, after I finished my training in the Midwest, I came to Arizona. A bit of a warmer climate, but it was also at a time when Mayo Clinic in Arizona was about a year and a half old. And there's been such amazing growth and expansion over the past 30 plus years, and I've been really honored to be a part of that. So we opened our campus in 2017, and we added 50 medical students per year in our school. And we're an expansion of the school that's existed in Rochester since 1972. We are not a school that just attracts local students, although we have great students that have ties to Arizona. We've been able to bring students from across the country to Arizona who would otherwise perhaps not come. And as we're graduating our classes, a number of those students are really staying in Arizona. And so we hope that we will contribute to the future workforce of Arizona as well. Also, our students just don't stay in the classroom and study or stay in the hospital and learn from patients. They're out in the community giving back. So we're very proud of a clinic that was started by some of our inaugural class medical students and is carried on, called the REACT Clinic. It was done in partnership with Arizona State University undergrads, where they're providing cares to refugee populations in the West Valley of Phoenix. So they have a clinic that is set up on the ASU West campus. They have arranged to have refugees come to the clinic, and they're providing health care that these individuals would not otherwise get. We also have students that are involved with the Street Medicine Initiative in Arizona, as well as Circle the City and other things. So we're contributing in many, many ways. So Mayo Clinic Alex School of Medicine is distinctive primarily because we are one medical school in 3 locations. So we have an equal size class here to the Rochester campus. We have opportunities for our students who start in Rochester or Arizona to also spend their clinical years in Florida. So coming to Mayo Clinic Alex School of Medicine means that you have access not only to Mayo Clinic in Arizona, but all 3 of our campuses with expert physicians, scientists, researchers, clinicians who are engaged in research, and educators. So that is really unique. The other thing is that our small class size makes us unique in that we have the ability to really get to know our students. I tell them the good thing about coming to Mayo Clinic Alex School of Medicine is the fact that we get to know you. The bad thing is you can't hide from us. And so we have really a unique ability as compared to some schools where classes are 150 or 200 students per class. We have the ability to really get to know our students, know their strengths, know their struggles, keep an eye on them, medical school is stressful, and so sometimes all medical students struggle, but we can keep a pulse on them. The other thing is that because we have a smaller number of students, we have a high faculty to student ratio, which means students can have a wide variety of people that they can develop meaningful relationships with for mentorship, sponsorship, research opportunities, etc. And of course, our students are able to be educated in the #1 healthcare organization in the country, which Mayo Clinic is, and it gives them a wonderful opportunity to see high quality, integrated, team-based medicine practiced. And hopefully the skills and values that we instill in them will help them be the best clinicians, the best scientists, the best educators that they can be in the future. This is an exciting time for Mayo Clinic in Arizona. The organization as a whole has invested an unprecedented amount of money to grow the Arizona campus. I believe it's the largest capital expansion in the history of Mayo Clinic. We're adding over 1.4 million square feet of additional space on our Phoenix campus. It will increase our capability of seeing patients. It will increase our research capabilities. We're expanding in a new integrated education and research building, wet labs, more laboratory-based research as well as translational research. We're also creating new education space. With this growth and expansion, we'll be hiring over 2,000 new employees, so there's going to be a tremendous growth in that campus. It will really be doubling the size by 2024. All of the investment in the Phoenix campus of Mayo Clinic means that we will become a hub of biomedical science and technology innovation here in the Valley. There's a lot of land around our institution up in North Phoenix that we hope will really attract companies and industry and investigators from outside of Arizona to come and really provide a synergistic environment where we can do high quality science and advanced medicine and technology. So in 20 years, I'd love to see modest growth of Mayo Clinic Alix School of Medicine. I can't ever foresee that we're going to be a medical school that has 150 or 200 students a year because we really like our small class sizes, but I would love to see some growth. I think it would be wonderful to see as we continue to graduate classes that our students come back and practice in the Valley, be it at Mayo Clinic or other places. Indeed, about a third of our medical students historically through Mayo Clinic Alix School of Medicine come back within the Mayo system. But I think many of our learners, once they've gotten a taste of how wonderful Arizona is, will come back whether it's with us or elsewhere. I really want to see our graduates become leaders in medicine, not only within Arizona, but across the country, so that they can be the innovators, the change makers for improvement. And of course, I want them to come back and take me as their patient, because 20 years from now, I will need many doctors, and so I want them to be my doctors in the future. We have a master's in the science of healthcare delivery, where our students learn about healthcare delivery science. They have a certificate that's delivered as part of their medical education, and then they have the ability to get a master's degree in the science of healthcare delivery through Arizona State University. In addition, we have additional dual degrees that students can do. There's an MD-JD program where they can truncate getting their law degree from 3 years to 2 years and do it in between their preclinical and clinical years. Some of our students go on to do an MD MBA, where they're doing the MBA part at ASU. There's also a master's in communication, which our students avail themselves of. So we've had great partnership with ASU and great collaboration through the years to provide additional opportunities. In addition, Arizona State University faculty, some of them actually teach in our medical school in a variety of ways, so that's been a great addition as well. And also there are research opportunities with ASU for our students as well.